Hello, and thanks for joining me for this video case tip. I'm Brynne McBride of ABC for Health, and today we're looking at the Access to Insurance for All Americans Act. This is brand new, another ACA repeal and replace proposal. This one came from Representative Darrell Issa. He's a Republican in California, and his plan, he says, is very simple. 8.5 pages, and it adds anyone who wants to enroll in the Federal Employee Health Benefit Program health plans. It opens up those FEHB plans to anybody who's interested. His definition of anybody isn't very distinct. It's not clear if you have to be a citizen or what your immigration status or what your income would need to be. That claims that it's sold without health, age, or gender underwriting, but once again, we'd have to look at affordability. Now, there is never a bad problem when you start talking about opening up insurance plans to grow the risk pool. That's a really great idea, and there have been proposals like that in the past. But this is not one of those such plans. This is a plan that's saying access to all Americans, and what it's really doing is really focusing on that one provision of selling insurance across state lines. This has been a drumbeat that's been repeated in a lot of these repeal and replace plans in the last several weeks. What it does allows employers to subsidize employees' coverage. It also would let states put their Medicaid beneficiaries into these same federal employee health benefit programs. We've had some shortcomings with this type of idea in the past. First of all, let's look at where we've seen something like this before, and it's actually right in the Affordable Care Act. The Affordable Care Act currently offers access to what are multi-state plans that are administered by the Office of Personnel Management. Guess who they administer? They get to administer the personnel which run the Federal Employee Health Benefit Program. So this is the proposal we're looking at today is something that exists in provisions inside the Affordable Care Act right now. And what's the shortcoming with that? It's not working. None of the FEHB insurers, other than the Blues, the Blue Cross Blue Shield plans, signed on. So there's only one insurer that's participating, and the plans that they're offering under this multi-state arrangement look exactly like the other marketplace plans that are offered. They copied the model of existing marketplace plans in order to try to make this work. Other shortcomings: making the FEHB plans enroll the uninsured continues to be a theoretical option for healthcare reform, but it has not, in effect, been a success. The multi-state plan option has not worked. Political and practical obstacles are the reason. That's going to continue to be an obstacle to this 8.5-page simplified plan of how to repeal and replace the Affordable Care Act. You can read a summary of this yourself. You don't have to take my word for it. We give you the link. You can click on the information button to read these links and read that plan summary yourself. You can also take a quick look at a Health Affairs blog that talks about this and a few other Affordable Care Act details as well. So if you see that button, that information button at the bottom of your screen, you can click that, read those links. You can also send us an email or visit us on our website, healthwatchwisconsin.org. Thanks for joining us.